With low back pain, one of the first things that we want to do is determine where the pain might be coming from. If you've read my ebook, you probably have at least an understanding of where pain could come from for low back pain. So the next thing that you want to do is perform an assessment. I highly recommend having an assessment performed by a trained professional so that they can give you an exact diagnosis. But of course, you can perform a self-assessment as well, which will give you a general idea of where your pain might be coming from. Of course, let me remind you to be very careful when performing a self-assessment. Don't hurt yourself, don't go too far. If you start to experience pain, stop and don't go any further. Just be very careful. So with the self-assessment though, there's only 3 steps. So the first step is you're just going to bend over and touch your toes, or as far as you can go until you experience pain. And when you do that, you might experience pain that radiates down into the buttock, or down into the leg, or down into the foot even. And if you have those pains, then that generally indicates either a radicular type of pain or a discogenic type of pain. Differentiating between those 2 types takes more of an expert touch. Next, what we have is called extension and rotation test. You're just going to put your hands at your side, lean back, and rotate. Of course, be careful not to hurt yourself. But when you do this, if you experience pain, that likely indicates more of a joint dysfunction, pain coming from the joint. And then finally, and the easiest, you're just going to palpate or just feel the low back musculature. And generally, with this, you'll feel some tight musculature, but what you're looking for are kind of more individualized tight points. And if you feel that, that indicates more of a myofascial type of pain, especially if this area is very tender. So again, be very careful in trying this self-assessment, but doing it can help you have a better understanding of where your pain comes from, which can help you determine what you want to do to deal with your pain.